and welcome to our video about the 21 weeks of pregnancy symptom and baby development. In this video, we'll be discussing the changes that are happening in your baby's development and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, and you may develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. Try to elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion: so, there you have it, week 22 of pregnancy. As your pregnancy progresses, be sure to take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. And most importantly, enjoy this special time in your life as you prepare to welcome your little one into the world. Thank you for watching, and we'll see you next time. Hello and welcome back to our pregnancy series. In this video, we will be discussing the 23 week of pregnancy, including the symptoms you may experience and the development of your growing baby. Symptoms: at 23 weeks pregnant, you may start to experience some new symptoms. One common symptom is increased fatigue. Your body is working hard to support your growing baby, which can leave you feeling more tired than usual. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand. This can lead to back pain, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving. You may start to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23 week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's pregnancy update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. Your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's pregnancy update. Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga, measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Trouble sleeping. As your baby becomes more active, you may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your healthcare provider. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, and sometimes, uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions. Join us next time on The Incredible Journey as we continue to explore the miracle of pregnancy and baby development.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29-week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello, and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy.